A Toronto-based relief organization that's known for helping people around the world wants to use drones to provide pandemic relief to First Nations in Canada. The people at Global Medic gave us a first look at what's involved. They've teamed up with drone delivery to deliver supplies to remote communities. Beausoleil First Nation on Christian Island is one. Global Medic says there's been significant difficulty accessing goods like food and hygiene items because of the geographically isolated location. Joining us now is Global Medic's Rahul Singh. Thank you for joining us, Rahul. And tell us a little bit about these communities. Nice to see you today. Tell us a little bit about these communities that Global Medic is reaching out to. How far away are they, and what are some of the conditions that they're facing?
Well, if you go way up north, you know, some of these places are really, really isolated. It's hard to get aid in. It's hard to get their basic supplies in. And then you can just imagine when folks here are hoarding supplies and stockpiling, you know, we have many choices and many stores to go to. If you're in an isolated community, you don't. So one of the proposals that we thought of was to use a drone to create an air bridge using these cargo drones. And then our first pilot's up in Beausoleil First Nation. It's only about a 5-minute run with the drone across the river, but it saves all that ferry, and the ferry's not great up there. So it's just more efficient aid delivery. It's just going to be multiple flights. But that's the type of problems these communities are facing, is that isolation.
And how were they getting their supplies before? Were they, you know, being trucked in, or, you know, how did things work before?
Well, before in Beausoleil, it would have to come in by boat, right? So you'd have a huge limitation on the amount of weight and the number of boats in. The cost really increases stuff. If you went all the way as high as, like, let's say Saskatchewan or Fort Albany, you know, you're coming in by air. So again, another significant limiting factor. So anytime that we see isolation as being the obstacle for us to overcome, we see the solution being using a cargo drone like the one over my right shoulder here, this little Sparrow, and bigger drones from it as well, just to be able to get the right aid to the right people at the right time.
Now, they have a wide range of needs. Tell us about how you decide what you can send.
Well, the first need that we know that many of the communities have is based on, you know, food insecurity. So we're providing, you know, non-perishable foods, rice and grains and lentils and beans, you know, stuff that families can cook and give to their kids, right, and feed their kids with. Probably the most important stuff that we really want to get folks, though, is PPE, right? So soap to wash their hands to stop the virus, to kill the virus, right? Masks like I'm wearing in order to, you know, prevent any virus spread, especially when folks are gathered in public or you know, or out of their house, right? We also think these cargo drones can be used to move, you know, COVID swabs and blood and, you know, Ventolin and other emergency medical supplies that can be needed. That'll become phase 2 of the project. So right now we're starting with PPE and food and all these basic hygiene items, you know, to get the supply chain going. But there's just so much opportunity with these drones on the types of things that you can send.
Now, you mentioned that you've got a phase 2 in mind. Tell us about how this plan will go forward, and how long do you think these operations will be running?
Yeah, well, we're going to run for the next few months. So we've set up a couple of landing pads, one on the island side and one on the mainland. So those are being built right now. So you can just kind of imagine a fenced-off area with, you know, the concrete pads so the drone can touch down, you know, safely. And then there'll be the operator from the community who'll come in and load up the cargo bay, which you can see in the drone, put aid in, and then it'll take off. It'll land on the other side. Same thing. The operator will remove the cargo, and then the drone can come back. So that's kind of phase 1. That'll move food and hygiene items and soap and PPE. Phase 2, we're going to reach out to government, and we're going to talk to the Ministry of Health and other partners and say, there's no reason that we can't be moving your emergency testing supplies, your COVID tests, your COVID swabs. If somebody needs an emergency medicine like Ventolin because their 16-year-old niece is short of breath, you know, we can use the drone to move that rather than the old archaic days of trying to get someone on a boat and bring them over. Meanwhile, we know what the solution to the problem is of the medical emergency they're facing. Let's get the solution to them using this drone. That I'm hoping to have scaled up in about 2 months' time. But right in the beginning, we're going to proof of concept, you know, show those flights, get them going, get more aid going across to show that this works, and then put other items into the cargo belly of this drone.
All right. Thank you so much for your time. Rahul Singh from Global Medic.